Being said, the real tips and tricks to achieve perfect isolation, as usual: plan, adequately spaced sponge hole. This is so important. The spacing between the holes are so important to be perfect. Proper and adequately sized holes. High quality rubber dam, very important for inversion, for no dam tearing interproximally. Floss ligature, proper anchor clamp and accessory clamp. A trained assistant is invaluable. I tell you, without a trained assistant, your life will be 10 times harder. But trust me, all those cases which I showed you, which I did earlier on, I was doing it alone, like solo. There was no there is no assistant at all to help me. So yeah, you can do it, just you have to struggle a bit and have many tricks up your sleeve. Learn all your tricks, so when you want to do that difficult case, you have so many things up your sleeve. Okay, communication is of course key. So many dentists face issues presenting due to the lack of experience and the lack of knowledge on how to present the rubber dam. So it's like a catch-22 situation actually. You want to use the dam, but you're inexperienced, so you don't know how to present the dam, and then in the end the patient does not want the dam. So what my advice is, if possible, prepare patients in advance. Of course, this is not always possible. Explain all the benefits of rubberdamology. Show them photographs, show them how it might look on their face, or show them pictures and explain how is it placed. What I do is I tell them about the rubber dam, and I tell them when I place it on, you might feel a lot of fingers in your mouth, and there'll be flossing, and it'll be sometimes covering their nose. So you tell them, okay, there'll be a lot of things going on, but after the dam is folded and everything's set, it'll be a relaxed procedure, and you can let us know, if any problems arise. So you have to speak with confidence, be positive. Although, of course, the first time when you're placing the dam, right, inside you'll be like anxious and nervous. You'll be like, oh my god, can I do it? Like, it's my first time, So the pro tip, do not be apologetic. This is gold standard treatment. You have to fake it till you make it. So okay, so these are the lineup again. We'll go through one by one. So Sanctuary Rubber Dam, it is homegrown, made in Malaysia. It is low protein, powder free, which reduces the chances of latex allergy in patients. It has very high tear resistance. It is able to be stretched more than 10 times the original size. It's usually available in peppermint or spearmint in scented. So it smells quite nice. So now we go to the proper dam selection. So in my case, bigger is always better, 6 times 6 inches. I think, I'm not sure if they sell the 5 times 5, but just take the 6 times 6. Color, you have 1, 2, 3, 4, 5 latex colors and 1 non-latex. Thickness and also material. So we'll go through one by one now. So you can go green, black, pink, silk blue and purple. So you can take a picture of this and you can see, you can refer back to the thickness, and we'll go through one by one which dam to use where. As you can see, the medium silk blue actually is the thickest, not the green blue thick. So if you want the maximum thickness dam, you need to buy the silk blue medium thickness. It's 0.28 mm, okay? And of course the black and the pink is the most medium range, is 0.20 mm. Okay, for endodontic isolation, I would advise using the green or the blue rubber dam in medium or even thin thickness. Okay, why is that so? So this is the green rubber dam. So these are the green and blue. These are the most economical dam, and rubber dams for endo, we use endo for endo every day, and they are the easiest to stretch, one of the easiest for the latex one. So the medium and the thin, they really can stretch. They are economical and they are fast, cheap and good. You know the saying, you only can choose 2 out of these. You can be fast and cheap but not good, or good and fast but not cheap. I believe this dam is fast, cheap and good. So get this dam for your endodontic isolation. I will have a cheat sheet at the end where you can screenshot which dam to buy for which situation. So for most of the anterior and posterior general isolation, I would recommend the black pink in medium. Black if you like black, pink if you like pink. So this has good stretch again. It's also economical and it has high tear resistance. You can use this for your general, workhorse dams. And then for deep margin isolations and also for general isolations, if excellence is what you're seeking for, definitely take their top of the line flagship model, their silk blue medium 0.28 millimeters. Good stretch, their thickest dam in their lineup. They have high tear resistance, great for inversion and maximum gingival displacement, as well as a calming blue color. It's just amazing. You won't regret getting this dam. So yeah, it just looks amazing and so relaxing on the eye. So with latex allergy, you have the purple dam. This has actually extreme stretchability. The non-latex dam can be really stretched. The only downside, it is slightly more expensive because it is non-latex. Okay, so this is the dam cheat sheet. So if you want, you can take a screenshot and you can go back home and later on you can go back and digest which dam to buy for. It's one of the most important slides. So I think this slide, if you don't take anything back from this webinar today, at least take this operational sequence back. Okay, I give you 7 steps to successful isolation. 1, I'll put all 7 up. Okay, let's just put all 7 up first. Okay, these are the 7 steps. So number 1, determine which teeth. Again, plan how many teeth you want to isolate. Number 2, mark the sheet and punch. So you have in your head the same 7 steps, or you can modify the steps to your own. Okay, you have the same sequence every time and you'll be working like a robot. You'll be like, whoa, it's just automatic. So you determine which teeth, you mark the sheet, you punch the sheet. Okay, this can be also done by your assistant sometimes, okay, if you train them well. Floss through contacts. This is so important. Check any interproximal issues, any overhanging amalgams, any joint restorations. If your floss cannot pass through, your dam cannot pass through. If your floss shreds your dam interproximally, it will tear, it will shred. Dam lives matter. So please take care of your interproximal issues. Sometimes you need to use a needle burr and actually break the contact or smoothen the class 2 filling or some sort like that, so that the dam can pass through easily. Number 4, choose your clamp. We will go through clamp selection later. Try on the tooth, do a stability test. Then you place your clamp, your dam, your frame, whichever method that you are comfortable with. Floss through the contacts, do the inversion, the clamp rock, some floss ligatures if you need, adjunct clamps. And lastly, before you start, do a water test or leakage control. Shoot some water into there. Ask the patient, is there any water in your mouth? Is it just saliva, or is there water leaking through? And look at the water. Is the water going down in the mouth? Water's going down, then okay, that is leakage. So then you need to control that leakage. Go about it. So here I think she had 4 crowns. Her 1, 2 until her 2, 2 were all crowns and needed 2 RCTs. So again, I exposed 6 teeth. This is how I typically fold my dam. So these are all taught in my rubber dam course. Amazing folded corners where when you use your handpiece and water falls down, it just goes into the corners, so it doesn't drip down the patient's neck, go onto their attire or the bib. Okay, so all these are repeatable, predictable rubberdamology. Every time you do it is the same thing.